Welcome students. Now today I am going to talk about how to score better marks with the same amount of knowledge that you are right now having. Many of you would have seen your seniors, batchmates and even juniors that in spite of having same amount of knowledge that you are possessing, they tend to score better marks in GTs as well in the main examination. And how does that happen? Why such a discrepancy occurs when the knowledge is same but the outcome is different? It is because in the application part, that is where many students lag. What do they do wrong in that? They are confused when questions are asked in a twisted manner, or when they see some questions that are they feel that are of unknown territory, but when you actually solve those questions and actually understand those questions, then you come to know that fine, this is within the possible territory that you could have won. So how can you score better marks? And in my coming series of video, I would be focusing on how to solve questions with that only basic amount of knowledge, and largely I would be covering past years INI questions, in which I will tell you that by applying common sense only and without having knowledge that is subject specific, you will be able to uh, get those questions correct. So uh, this is my intro part, that what I was trying, what would be I would be doing in the coming videos. And one of the most important part that is often neglected by the even the coaching teachers and also by the students is that they fail to understand the psychology of the paper setter. What I would tell you is that ultimately the questions are being set by someone human on the opposite side. If you start understanding what are their limitations, then you would be able to more appreciate the question asked, and you would be much easily able to answer the questions that they ask in INI questions, or that for that purpose need questions also. So just hear me for 4 5 minutes, and then you would understand what I do mean by these things. Firstly, remember that there is a rigorous qualification that is required to become a paper setter in any of the reputed exams that we face. So definitely AIMS would, or for that matter NEET, would have a board that would have only professors with certain years of qualification. But the thing is that the professors are also faced with the dilemma of setting the type of question they would be asking you in the INIs and needs, because they have to set such question that is able to differentiate the studious from the non-studious one, but at the same time they are correct in all manner regarding the question that has been asked. See, if you would be attempting the questions in set by your coaching teacher also, there you will be also finding that they commit a certain number of mistakes, whether it may be on their part, they would be committing the mistake, or in the printing part. So think of that in INI or NEET like exam, these mistakes should not occur. So what is the safest route that a teacher would adapt? Firstly, he should be able to defend the question if that question is taken to the court also. So if that so to say, see, first of all, whoever is setting the paper, he wants to save his job. So what is the safest way of saving his job? Is that asking the question verbatim from any standard books. So when for example the things goes to extreme and haywire, and they are taken to the court that regarding this question or that question, there also they would be able to defend their question. They would be framing questions to that extent. So what I am trying to tell you is that if you know the limitations of the examiner, your chances of getting more questions correct would increase dramatically. So right now I would be just telling you the outlines that I would be adopting while solving the questions. Like any kind of extreme sentence would be wrong. Like what are those extreme worded sentences? Like all of the above, none of the above, or whenever these types of prepositions are used, always be vigilant that what they are asking, because 80% 90% chances that that question goes is going to be wrong, that statement is going to be wrong. For example, take this way: if someone says that all boys are good or all boys are bad, then in itself this statement is wrong. Likewise, when we apply these two in our medical sciences, there also the things are in a similar fashion. There also this sentence will not hold true. So one thing is that these are the stream worded sentences that you should be aware of. Now secondly, if in a sentence uses a preposition can, if those prepositions are being used in your questions, then more chances are there that the statement is good, that statement is going to be right. So if you, even if you don't know the answers, you can apply this logic to get those correct answer, and I in the coming videos will tell you how to apply that. And in today's video I would be applying these methods to a number of past year asked INI and NEET PG asked questions. So let us begin. Now my first question is, which of the following is false regarding imaging in the primary survey of a trauma patient? A. Hemodynamically unstable patient should not be sent for CT scan. B. All patients should have chest X-ray PA view only. C. X-ray of the pelvis is essential in primary survey. And D. X-rays in primary survey must also be done in pregnant. So now in this, B option is that option in which they have used the word only. So let us again read that sentence. All patients should have a chest X-ray PA view only. Now by here it means that if someone, if whatsoever the ailment is, only he would be allowed that there should be PA view only. That seems absurd. So this is the option. Even if you have not studied primary survey, you don't know the ABC of primary survey, but still you can get this question right by outlining this word only. Now next question I would like to highlight, that is, a 4-month-old baby was brought with diaper rash. The parents gave a history of recurrent infection in the past 4 months, which required frequent hospitalization. On examination, white patches were present in oral mucosa which could be scraped easily. The biopsy of the thymus showed remnants of Hassel's corpuscles. Which of the following statement is false about this condition? Now it has also autosomal inheritance pattern. It is adenosine deaminase enzyme is deficient. It is due to defect only in cell mediated immune response. B cell count can be normal. So let us start from the first sentence. It has autosomal inheritance pattern. It is not a big deal, and any disease will have two patterns, autosomal or sex linked. And if there is some remote chances of a disease being autosomal, I mean in this way, in this question it has autosomal inheritance pattern, this question will majority wise will also be right. Now we move on to this B option. Adenosine deaminase enzyme is deficient. So from this option you can now really find out that okay, they are talking about SID, because I don't think that many of the people majority of the people would be oriented regarding Hassel's corpuscles and the biopsy of the thymus, and just by looking at the question it is very difficult to click that SID is being asked. Now we come on to the C option, that is, it is due to defect only in cell mediated immune response, and D is B cell count can be normal. Now in the C option you can see that they have used the word only. So again you have to be vigilant in this statement. Again, would be reading this sentence. It is due to defect only in cell mediated immune response. So the examiner that is setting this question should always be have to disprove that humoral immune response is not there. And if in any literature, in any remote literature, someone and somewhere something is written regarding the humoral immune response, then this statement will not hold true. So but naturally examiner will always be trying to play a safe game, so they are making this statement wrong just by putting only. So how would examiner have framed this question? Just revert back. So they would have this is a certainly a case question, but afterwards ABCD option are from the textbook. So in textbook, it is due to defect in cell mediated and humoral immune response. Wherever they have picked this question, there would have been this line, because if only cell mediated immune response would have been there, then that is a characteristic thing or something that is unnatural, and something that is need to be remembered. And then your coaching teachers and everyone would have taught you these things, and if that has not been taught under this disease, so definitely this statement is wrong. So the logic of that is, if the sentence has only, then it is certainly wrong. By that logic, you can always get these questions and answers correct. Now, which of the following interferes with absorption of calcium? So they have given the option like glucocorticoids, phenytoin, tetracycline, phytates and oxalates. So ABCD option is given, and what will many of you would be jumping on is that they will be immediately jumping on the option B, that is 4 and 5, phytates and oxalates, because that is what we are taught in pathology and everywhere, that they have chelating property. But also you need to also remember that if the examiner is thinking of setting 4 and 5, then examiner has to make sure that none of the calcium can be absorbed by glucocorticoid, by phenytoin, by tetracycline, and by any of the mechanisms, and that is very difficult to prove. That means you are almost next to God if you can certify that okay, fine, whatsoever mechanism may come, glucocorticoid, phenytoin and tetracycline will not absorb the calcium. And these are all organic compounds. Somewhere some things, if even a single cation, calcium cation gets hinged anywhere, then this whole question will fall flat, and that would be in that the option B. The examiner, it is the onus on the examiner to prove that 1, 2, 3 will not help in absorption of calcium if he has to put B right, but that is very difficult. So you will on certainty go for the B option, that is 1, 2, 3, 4, 5, because any molecule, see, we have studied organic chemistry and all, if there is any kind of molecule, somewhere something will get absorbed, and examiner has to make sure that not a single cation goes through 1, 2, 3. So by this logic you can eliminate a lot of questions. Now next question is, a 60-year-old postmenopausal patient with a previous history of Colles fracture came with complaints of lower back pain. On evaluation, her T score was 2.5. Which of the following statements are false about the management of her condition? Teriparatide should be started before supplementing with bisphosphonates. Bisphosphonates are not given for more than a year. Calcium requirement is 1200 mg per day. D is oral vitamin D3 is given along with oral calcium. So many would be confused that how to remember that 1200 milligram per day calcium, and teriparatide should be started before supplementing with bisphosphonates. So I don't know that because in the postmenopausal chapter, that is menopause chapter, we have not been told that what should be given and in what amount. So how to solve that question? So remember that in the B option they are saying bisphosphonates are not given for more than a year, and that is again an extreme statement. If some patient somewhere if benefiting from that drug, if it does not have a very prominent side effect, then you would then you will continue it for a year if that problem is there, if that causative disease is there. So again, B option would is a odd one out in all of this. So go for the B option. See, what I am trying to say here is that these are the methods that many of the toppers they apply in their,
and whatever these toppers are doing, they are doing in their subconscious mind. So in the coming videos I would like you to decipher and tell these hacks that this people with who are topping are using. And the fun thing is that these people also don't uh, will not be able to tell you verbatim that these methods they are using, they are doing so in their subconscious mind. And it's just how intelligence translates into rank in the examination. So in the coming videos I would plug this gap, and hopefully many of you would be getting benefited from it and improve your rank in the coming exams and help you in getting your dream branch and college.